Hello and welcome to the IBMS Biopods. I'm Rob.
And this is Becca.
These Biopods will give you an insight into Congress with exclusive interviews, behind-the-scenes chit-chat, and maybe even a drop of science.
So put down your pipettes, move away from the microscope, and get ready for a
Biopod Deep Dive.
Happy New Year and welcome to our first podcast of 2020. In this episode, we're joined by esteemed haematologist Professor Barbara Bain, who talks about everything from her formative years to her passion for Italian art. She's also written a feature for the January issue of The Biomedical Scientist. So if you enjoyed this podcast, turn to page 24 of the new issue. Thanks, and hope you enjoy the episode.
Hello and welcome to the IBMS Biopods. Professor Bain, it's lovely to have you. For the benefit of our listeners, if you could just introduce yourself and tell us a bit about you and your work.
Right. So I'm the Professor of Diagnostic Haematology at Imperial College London and an honorary consultant haematologist at St Mary's Hospital. You might describe me as semi-retired. I work half a day a week regularly teaching registrars and teaching biomedical scientists, and then some days a week when there are students to be taught, either undergraduate or postgraduate for Imperial College.
Brilliant. So tell us a bit about your early life, and you grew up in Australia.
Yes. So I graduated in medicine in Australia. I then trained as a physician in Australia and got a membership of the Royal Australasian College of Physicians. Then I came to the United Kingdom to work in Professor Dacey's department at Hammersmith Hospital to start training in haematology. So I did a year with him. And for that, I had the support of the Australasian College of Physicians, who gave me a scholarship for a year. Then I got a job at St Mary's Hospital under the late Professor Mollison. Worked there for a couple of years and did some more training. And then I went back to Hammersmith for another year and did the exam of the Royal College of Pathologists. So I was then trained as a physician and also as a haematologist. Then I went back to Australia and worked for about 4 years there. And then I came back to St Mary's, where I've been ever since.
And what made you come from Australia over to England? Was it there was more chance for career progression, more opportunities?
Well, in 1971, when I first came, Australians are very mobile. And in those days, everybody who wanted postgraduate training tended to go to either Britain or the United States. Nowadays, that's much less done because nowadays there are plenty of training opportunities within Australia. But in those days, medics in Australia travel greatly to train.
And you specialised in haematology. Why did you decide to do that?
I quite liked the combination of laboratory work and clinical work. I found histopathology quite interesting as well, but I wasn't really prepared to commit to not seeing patients. Whereas with haematology, you have the great advantage that you can see a patient, treat a patient, look at their bone marrow and blood in the laboratory and so on. So it's it can give you a very integrated approach.
So is seeing the patient something that's important to you with making a clinical decision, or are you someone who likes seeing people and interacting with people? Is that part
I think it seems sort of more genuine medicine to be dealing with patients than merely to be in a laboratory just seeing patient tissue. So I think people who go into medicine in general because they like the idea of seeing patients, and I didn't want to give that up early in my career. Later in my career, I did far more laboratory work and much less clinical work. And since I've semi-retired, I've done only laboratory work, not clinical, because it becomes impossible to keep up with the volume of new knowledge to look after patients unless you're being very full-time at it, whereas laboratory haematology, you can keep up with working part-time.
And we've heard a lot at this Congress about the profile of the profession. And do you think this lack of the kind of clinical patient-facing side of things has an impact on the way the public perceive the profession? Because you see lots of TV with nurses, doctors, but because most biomedical scientists, for most of the time, are behind a lab door, do you think that affects the way the profession is perceived?
I don't think it does from the point of view of the general public. I think they can accept the idea that there are scientists working behind the scenes who are doing important things, although maybe you should get a popular television program made about biomedical scientists, increase their profile. But what I do think has changed in the time I've been in the profession is a rather regrettable division between clinical and laboratory haematology from the point of view of the haematologist, because clinical work has become so onerous that it's often very hard for haematologists to get time to go to the laboratory, and you then tend to get a small number of haematologists who do the laboratory work, but maybe not enough who are committed to that side of it.
Well, and you've had some mentors in your life who have kind of carried you through your career a little bit. Who are these people, and what kind of influence has having mentors had on your working life?
So there was the late Professor David Galton and Professor Daniel Kotowski have been the important mentors. When I first arrived in Hammersmith, they were in the leukemia unit, and I worked closely with them for a number of years and kept in touch for quite considerable time afterwards. Why they were important as mentors to many people was that they were both very laboratory and science-based and very interested in research, but they were also compassionate people who cared very much for their patients. So I think they were two consultant haematologists that anybody could emulate.
And you've also said about with the mentoring, and you've also spoken a lot about your teaching and how important that is to you. Do you think there is enough currently of people who are entering the profession and people who are just starting on specialist routes? Do you think there is enough mentoring and enough kind of dedicated teaching for them and enough guidance?
I think it's probably a bit patchy, and what's made it more difficult is now that junior staff rotate between quite a large number of hospitals. So if you've got someone in one hospital for a year or 2 years, or 3 years or 4 years even, then they're going to be very closely guided by the consultants in that hospital. If they're rotating at short intervals, maybe 6 months only in one place or a year in one place, I think it's harder, and it needs a lot of communication between the people who are guiding them in different hospitals to make sure that they are being adequately supported. Obviously, rotating in around different hospitals give you a broader experience, so it's got advantages, but it has got disadvantages from the point of view of being guided by somebody who knows what problems you've had, knows what your expectations are, what your aims are, and so on.
Are there other countries who have better models and systems in place than us that we can learn from? Or
I suspect they're probably all having fairly similar problems.
Right. And you've written very, very widely. You've written teaching materials, textbooks, and academic papers. What drives this kind of need to write and across so many different formats?
Well, I've always been interested in teaching, even from very early in my career, and the writing is really an extension of that. But I've always kept copious notes on things, and then it seemed sensible to put them into a format that could be shared with other people. And both teaching and writing are a good way to make sure you keep up to date, because you need to be reading widely. You need to be learning yourself if you're to teach. Also, your knowledge can't be static. You've got to be expanding your knowledge. So teaching and practice and writing, really, the three of them go hand in hand.
And you said at the start that you were semi-retired, but it seems to me like you're incredibly busy. You're doing lots of talks, you're doing lots of writing, you're doing lots of work, and you're also speaking fluent Italian. Is that correct?
Reasonably fluent, yes.
A lot better than my Italian, I imagine. And very interested in art history. And you seem to have loads and loads of things going on. How do you balance all that and find a kind of happy medium with your life?
Yes, rather too many. I although I'm semi-retired, I work pretty well full time, because when I'm at home, I'm at the computer the entire day, either writing or reading journals or editing. So I edit for the British Journal of Haematology. I edit for a French morphology online teaching resource called EMAT. I've just quite recently started editing for the Thalassemia International Federation, making sure their things are in good English that'll be easily understood by everyone, and so on. And I do a monthly morphology update for the American Journal of Hematology. So I'm at the computer doing all those things and also updating the next book that's meant to come out. I need to actually do a bit less. I am attempting to do more than I can reasonably do.
It sounds like your semi-retirement is a lot busier than my full working life, to be
It's
honest.
possible.
And you translated a couple of books into Italian. Is that,
No, out of Italian, yes.
How did that project come about?
Well, I've been learning Italian for going on 20 years now. And the books I've translated are written by friends who are interested in morphology. So they're morphology textbooks, which I translated into English. A few of my books have been translated into Italian, but not by me. My Italian is not quite good enough to translate a large textbook. But also Italian hematologists, at least, are generally pretty fluent at English, at least from the point of view of reading it, if not speaking it. So there's some of the books have not been translated for that reason.
And let's talk briefly about art and art galleries and what inspired that love, because I'm sure a lot of people listening will want to know
Right.
a bit about you as a person. How that
Well,
came
the
about.
Italian came out of that. In fact, I've always been interested in art. I actually did art at high school. We did 6 subjects at our final year in my high school, so you had scope to do quite a lot of things. So one of my 6 was art. My main non-medical interest is a saint called Saint Sebastian, who's a plague to be invoked against. Who's a saint to be invoked against the bubonic plague. So he's of medical interest, and I and my husband have been collecting images of him throughout the world for the last 20 years or more. We've now got a collection of about 8,000 images on our website. And we started to learn Italian to aid this research, because a lot of the important works of art are in Italian museums and churches, and we wanted to be able to talk to people, and if a work wasn't there, to find out where was it, has it been stolen, have they put it in the storeroom, what have they done with it. So we started off learning Italian purely for art history reasons. But then because we'd learnt the language, I then started getting links with various Italian hematologists. So I've lectured quite widely in Italy, in the Veneto and Liguria and Sardinia and down in the bottom of Italy as well. And the Italians are so pleased to have a foreigner who is willing to lecture to them in Italian that they're prepared to put up with quite a lot of imperfections in your language. And also I've got Italian colleagues in Britain who check the PowerPoint presentation, so at least they're accurate, even if there are errors in my spoken Italian.
And what are you going to do with all the? Are you planning a book? Or is it just a personal research project that you love doing? Or
we did try to get a book published on Saint Sebastian in art a very long time ago, and it was almost accepted for publication, but they decided it wasn't economically viable. But I'm still hoping that one day it might get written and published. But until such time as that happens, the website is there and it's freely available. So if anyone wants it, if they just put in Saint Sebastian in art, they'll find the website and they can look at all 8,000 images, which have got quite a lot of details about the artist and the provenance and all that sort of thing.
And have you got a favourite piece of art? If people are listening and they're going to go and look at one picture or one piece of art, what should they go and look at?
One of the most famous is a Florentine artist called Sodoma. That's quite an attractive one. That's an almost naked figure pierced with arrows tied to a tree.
Sounds careful.
Yes. Some of the Venetian ones are rather good. Titian, for example, did a very beautiful one. They're very varied, though. So in the time of the Renaissance, a lot of them were naked, and near naked. In recent times, he's become a homosexual icon as well. But in other countries, he's sort of sober and clothed and maybe holding his arrow and dressed elegantly like a gentleman. So it's very varied. And he's coupled up with different other plague saints. So he often appears with St. Roch, who's also, he's a French saint who's invoked against the plague. So the plague element of it is quite interesting. And he tended to get painted enormously when there was an outbreak of the of the plague in the hope that people who prayed to him would be spared the ravages of the plague.
Were they?
Well, in the 6th century in Rome, the plague stopped when he was invoked, so that was his first claim to fame, but it wasn't a randomised controlled trial.
Of course. And what about one tip for people? I'm sure there'll be lots of young people entering haematology listening to this thinking they would like what one tip would you give them for their career? One kind of takeaway piece of advice?
Well, to be enthusiastic and want to learn, and for me, the microscope is quite central, and I think we should try and keep that central. Obviously, modern technology is amazing, but sometimes with a microscope you can make a diagnosis in 30 seconds, and even if you can't, it will illuminate all the other special tests. So love the subject and don't neglect the microscope, I would say.
Brilliant.
So these are very light-hearted, so
Okay.
you don't need to think too much about them. So I'll start off, following off from that one from Rob. What's the best piece of advice you've ever been given?
I don't think I've ever listened to any advice.
That in itself is very good advice. Who is your science hero?
Don't think I've got one.
No, that's fine. Have you had a favourite diagnosis throughout your career? Is there anything that's been particularly exciting or surprising?
I guess you have to distinguish between those that are critical for the patient and therefore terribly important, and those that are just entertaining for the person looking down the microscope. From the point of view of life-saving diagnoses, I think malaria is very much up there, and I've seen a number of patients where the clinicians haven't thought of malaria and it's been recognised just on a routine blood film in the lab, including some who've been quite gravely ill when the diagnosis is made. And similarly, acute promyelocytic leukemia is a terribly important diagnosis which you may make with just a few seconds at the microscope. So from the serious medical point of view, I'd put those two things first. From the point of view of entertainment, red cells are quite interesting, and Southeast Asian ovallocytosis is a diagnosis I quite like because it's interesting to look at. And when I'm sitting at the microscope with trainees, we often see red cells shaped like fish or dragons or something of the sort. They're all very entertaining.
Excellent, that's a lovely answer.
We even have a biomedical scientist gave me a lovely image of a monocyte shaped like the British Isles. I'm quite fond of that one.
Oh, wow. That's incredible. Start an image collection of those as
Yes.
well. Do you have a favourite piece of lab equipment?
Well, obviously the microscope.
Yeah, excellent. Can you describe your job in 3 words?
Interesting, challenging, and maybe a bit too much of it.
Very good. And lastly, what is your favourite thing about Congress?
Meeting old friends, really. I find that I like the science, but meeting people that you've worked with over the years, I put ahead of the science, in fact.
That's excellent. Perfect.
Now we have overrated, underrated, correctly rated. So team building exercises, overrated, underrated, or correctly rated?
Probably correctly.
Yeah.
That sounds a bit modern for me.
Lab coats.
Oh. Well, of course, doctors are instructed not to wear white coats any longer because it's seen as a way of transmitting infection. I guess lab coats are important as long as they're changed often enough.
Socialising with colleagues.
Very important for team building.
Signing birthday and leaving cards and leaving nice little messages in those.
Probably overrated. I haven't had a leaving party yet.
Is that a heavy hint?
No, I've declined them.
Social media in the workplace.
Too modern for me.
Too modern.
And I can barely cope with my daily emails without engaging with Facebook and Twitter and so on, so I tend to ignore all of them.
And the final one is night shifts.
Terribly important. So I suppose I'd have to say they might be underrated. I think the people who are on night shifts are really crucial and need to be acknowledged.
Brilliant. Professor Bain, thank you very much for your time.
You're most welcome.
Thanks for listening. We hope you enjoyed the episode, and don't forget, this can be used for your CPD.
See you next month for another Biopod. This is Becca.
And Rob,
Signing off. Bye.